for the last 4 years, drchrono focused on the physician side and the staff side. So essentially, we went from, in the last 4 years, to 30,000 physician signups. And basically what we did is we really tweaked and made a great interface where doctors feel very comfortable. Now, for the first time ever, we started to focus on the patient side. So a physician has control within the drchrono platform to share parts of the medical record with their patients. And what we're doing here is basically we have an option in the drchrono platform called patient access. Basically what a physician can do is enable access or disable access and share data with patients. Once they share this data with the patient will get an email like so, and essentially the patient signs up to the OnPatient platform. And when a patient basically gets access to the OnPatient platform, they can see their appointments, they can pay bills, they also have a health profile, they have messaging, they also have the app section. And essentially what a patient can do is, in the appointments section, view past appointments, view upcoming appointments. They can also schedule appointments. So here's just selecting a date and basically schedule that appointment with a physician. And also they could fill out forms. So let me just show you past appointments for a second. I'm just going to dive into that. So basically the patient can see this is the date that I came in, this is the assessment, this is the plan. They can download this if they want, and it basically is an easy way for the patient to see what's going on with their past appointments. Now, one great thing that's great for the doctor and for the patient is that they can fill out forms. So when I hit the fill out your forms section, essentially what this is like our iPad app, where the staff member or the physician hands an iPad app to a patient in the waiting room. But this is more of the experience happening from home, from the web. So basically a patient can just fill out this information at home, at their convenience. So I'm going to hit edit all, and basically the patient can just flip through this, look at all of their information. And this is really great because it allows the patient to kind of think about if they have questions, if they need to update anything, they can just look through at their own leisure, update insurance information, put in reason for the visit, and questions that they have for the doctor. So you're way more aware as a physician or a medical provider to basically know what the patient is asking. One great thing we also have is HIPAA forms and consent forms. Basically, the patient can read these from their home whenever they have time. Really great, really simple. It makes things much easier, allows the patient to do things at their own pace. So I'm just going to sign the consent forms, hit finish, done with that, and that's done with the onboarding. Basically, another great thing we have is messaging. So basically, a patient can compose a message, send it to a physician, and ask a question, and there could be a dialogue that way also. And the last thing I just wanted to show you was basically the app section. Now, this is something totally new, where basically a patient can plug in things like iHealth, an FDA-approved blood pressure cuff, or iHealth digital scale, or other FDA-approved devices right into the drchrono platform, and we can record that data, and essentially the patient can share this data with the physician. So it's much more of an open dialogue where a lot of our responsibility also goes on to the patient end.